My name's Carley Hollis. I graduated from Galen in 2014 from the ADN program, and I am currently a hematology oncology nurse. When I was 8 years old, my mother was diagnosed with breast cancer. So my whole life I was kind of brought up in seeing the medical things that would happen with her. And as I got older and as I spent more time with her in hospitals, I started noticing that it's actually the nurses that are the ones who are spending the time and taking care of the patient. The doctor's treating the patient, but the nurse is caring for the patient. And that's when I decided that I wanted to be somebody who was going to care for a patient, and if I couldn't cure cancer and make my mom better, then I was going to do everything I could to make her feel better. And that's what I think that nursing does, and that's why I ultimately wanted to become a nurse. I didn't want to wait a year and a half to even begin something and then go on to spend another 2 to 4 years achieving that. When Galen gave me the opportunity to begin and finish in 2 years. The hands-on, you start clinicals and things like that much faster than you do at any other college in the area. You usually begin your clinicals, I think, by the second semester you're starting to work with hands-on things. And in my mind, if you're gonna, best way to do it is to actually get in there and do it. And so having your nose in a book only can get you so far, and they were the only ones that were willing to have that in their curriculum where it starts so fast. And the professors here like to teach. They like doing what they do. So we didn't come in to a classroom to find somebody standing at a podium just kind of, straight-faced and this is what you got to know and this was that. I mean, it was very interactive, and they all are nurses. So they've been from the hands-on, those professors are nurses. So they taught like a nurse teaching to a nurse. So I started Galen in 2012 in January, and my mom passed away in March of 2012. And here they were very, very, very supportive. I remember a professor, I sent him an email saying, listen, I have a test today, but I got a call saying my mom's coming home on hospice and I don't know what to do. And he said, you go be with your mom and call us or just let us know what's going on. And that was actually the last day that I ended up seeing her, on a Friday, and she passed on Saturday morning. That was very much above and beyond think what most places would offer to somebody, especially I had only been a student for not even 10 weeks when this happened. So I know that the hospital that I worked at knew about Galen from the get-go, and the director who conducted my interview and who ultimately hired me, she was interested in hiring Galen nurses because she had seen the nurses that they produce and felt that there wasn't a single one that wouldn't be a good member for her team at the hospital. In a heartbeat. The skills and the knowledge and everything that I learned from going here, I don't think I would have gotten anywhere else. So yeah, this is definitely a school that I would recommend anybody to go to start out if they want to be an LPN, if they want to go through the associates, if they want to continue on to the bachelor's. And when the time comes that I do want to further my education, this would be the only place that I would go. Galen's made me into a nurse. And I think it's completely changed my life. Being an oncology nurse, I thought would have been way too close to home given the fact of my mom being sick, and now I wouldn't trade it for a moment. Every day I go in and see patients that are just like my mother, but I get to go in every day and see patients that are just like my mother. And if it wasn't for Galen, I wouldn't have had that opportunity.